Hi there, I'm Amanda, the super medic, and today we're going to catheterise my friend Willie. So first of all, we'll have a quick look at the anatomy. We've got the penis here, the shaft of the penis, and then in here we've got the bladder and the prostate. We have to be careful with men because if we meet any resistance when we're putting the catheter inside the bladder, they could have an enlarged prostate and we could actually perforate it. So if you do meet any resistance when you're catheterising, please stop and contact your medical provider or your telemedicine support person. In the catheterisation kits that we get in our medical kits, we get a catheter bag, some tweezers, some intrasite gel to numb the area, a syringe, and 10 mils of water and some cotton wool, and also a nice pack with a sterile field, a dressing we can put down so we keep everything clean, and a few cups, sterile cups to put the fluids in. So I tip the chlorhexidine in, and first of all I'm going to give him a clean. So what we need to do if the man's got a foreskin is actually pull it down and give it a good clean around the shaft. Sometimes it can get a bit manky. And in medicine, we like to say that the top of the body is cleaner than the bottom. So to cleanse the man, I'm actually going to go from the eye of the penis round in circles. And once I've gone around in a circle, I try not to backtrack over areas I've gone. I then pop it on the other side. So I'm cleaning from the right side that's clean to the left side that is my dirty area where I've got my rubbish bag. Now I'm going to get everything prepared. So I hold the man up and in the eye of the penis I squirt some of this gel. Then I'm going to pinch him and just hold it for a minute for the gel to go in and numb the ureter. Most beneficial in this procedure. Then I go away, wash my hands again or take off my first pair of gloves so I've got my second pair and I'm ready for the clean, hopefully sterile procedure. I take my catheter and first of all I plug it into the bag so when we get the bladder, the urine coming out won't go everywhere. And my method is, I'm going to turn him on the side, is I hold him up at nearly a 90-degree angle and just start pushing it in. I'll warn you, I'm an emergency nurse. We do tend to be a little rough because we're all working in a hurry. So pushing it in, about now, you've seen that catheter's gone into the bladder. I met no resistance, so the prostate's okay. And now urine will be flowing down into the bag, so I'd see a passage of urine coming down. When I see that, I want to anchor it. So I inflate the balloon inside the bladder with my syringe that I've drawn up 10 mils of saline in. So I don't know if you can see that, but if you give it a tug here, you'll see that the balloon's anchoring it inside because I've actually, you can easily pull it out if the patient's confused or frustrated by it. And I've actually seen men pull the whole balloon out and boy, do they look in pain and shocked. Once this is in, the client's going to keep saying that they feel like they need to go to the bathroom because the balloon's sitting on the bladder wall and making them feel like there's residual urine in the bladder. So the urine should be draining into the bag. We should be getting at least 50 mils an hour. If we get less than that, then we need to contact our medical provider because that can be a medical emergency. We also need to open up the bag down here. We've got our open and close. Make sure it's closed when you start. Get a pot of urine, do a dipstick, a urinalysis test to make sure that there's no infection. And this will need to be repeated every day because it's quite easy for the catheterised patient to get an infection because the bacteria can crawl up the catheter and inside the penis. So each day I come along with an alcohol swab or some chlorhexidine and give it a nice clean and make sure it stays nice and sterile. So I hope you've enjoyed the lesson. Happy catheterising, and please contact your medical provider if you have any issues and stay safe at sea. Cheers.